So this video is about some practical information that might help people participate in research processes. Now, we're not wanting community members to be experts in research. They have their other expertise that we want to draw upon. Researchers have trained and done all their work to become researchers, but they should be able to explain what it is they're doing. But to give people a bit of background that might be useful, I'm going to explain a few things about major categories of research. So to start with, I'm going to talk about quantitative research, which is with numbers, and qualitative research, which is no numbers. So in quantitative research, we might do a range of different things. We might take the blood of people attending a clinic and look for the levels of a certain enzyme in their blood. Or we might ask people to fill out a survey to indicate their preference for a certain thing. Or we might take data from big data banks, like how many people in Australia went to hospital for a certain condition last year. In qualitative research, we'll do different things. We might interview people or run focus group discussions or look at the ways that language are used in policy documents or in media. And each of these approaches are absolutely valid and need to be used in the appropriate moments. And that's where a researcher will be able to explain the reasons and choices they've made for using particular types of methods that are best suited to the question that they're asking. So let's run through a few examples. One of the major projects our centre does is the Gay Community Periodic Survey. Now, this survey has been running in states and territories for more than 20 years. So each year, men who have sex with men are recruited in and asked similar questions or the same questions year after year after year, so we can produce beautiful graphs that show trends in behaviour over time. The Australian Needle and Syringe Program survey does similar types of work, asking the same questions year after year to look at patterns over time. In another example, we might want to test an intervention to see if one medicine is better than another medicine. And to do that, there's a number of ways in which you define the sample. So you have a carefully constructed group of people that you know are similar, and you randomly select one person to go to the intervention group and one person to go to the control group, and so on and so on and so on until you have these two groups. You give the intervention group the medicine, you don't give the control group medicine, and after a while you measure the outcome. And it's important that that group those two groups are similar to start with, so at the end of the project you can say any change we saw was because of the medicine and not some underlying difference between the groups at the start. Another example might be, well, let's change the way we do healthcare delivery, change a model of care. And there's lots of different questions that fall out of that. Will health outcomes be better if we change the way in which we deliver health services? Will it save the health service and the society money over time? What do staff think about the changes? What do clients think about the changes? What does that give us information if we want to roll that out to all the other similar clinics in the country or around the world? And each of those might require different ways to investigate it. We might have to do a survey of clients, or we might have to do interviews with participants. We might have to measure changes over time or the costs involved in delivering types of services. So they are technical elements of research, but as I mentioned at the beginning, we're not asking community members and community organisations to have that expertise. We want the critical types of questions that community members can ask, because we can't think of everything, and there might be critical perspectives that researchers missed. And that's where the expertise of community members come to ask those critical questions and make sure the research is as good as it can be.